You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're going to take you inside the surgery room here at Hoag Hospital and show you a surgery that corrects flat feet with Dr. Ivar Roth. My advice, stick around for the latest edition of The Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
Now, before we get into today's topic, which is what you can do to correct flat feet and I guess the pain associated with it, tell us about your practice.
Well, I'm a foot and ankle surgeon here at Hoag Hospital. I've been on staff for over 20 years, on active staff, and I'm the only foot and ankle surgeon that has full privileges to do the foot and ankle here at Hoag Hospital.
Okay, now this new procedure, it is new, is that right, to correct flat feet?
It is a brand new procedure. There's only 2 of us in the state of California that are master certified to do this new procedure.
Now, I've met a few of your patients. One of your patients, I said, said they went to 7 other doctors. What they liked about you is you said you could do something about it. And I said, well, what's different about it? And she said, well, Dr. Roth does things that other doctors don't do. Is that true?
That is true. Primarily because of my surgical training. I had a 3-year residency over 20 years ago, which was very rare. So I've had time to modify my procedures, and I was trained by some of the best surgeons in the world for foot and ankle surgery. And I've always kept my ears and eyes open for doing new procedures. Well, a couple actually just came up recently, and I was very impressed with them, caused me to change my way of thinking. So I had to look at a new way to think about doing flat foot surgery. Previously in the past, it was a very long, drawn-out surgery and painful and very unpredictable results. This new surgery that was introduced to me was hard to believe that it could be as good as it really is. But I researched it out and happened to be friends with the doctor that invented it. And when I went back east to see his practice and see his patients, I really became a believer.
Okay, flat feet really causes pain. How so? Help me understand why having flat feet, if you don't have pain, and this, you told me this off camera, that they're headed for pain. How so? What causes it? What's going on?
Well, there's a couple things. If you have a mild pain and that's what you're used to all the time, you really don't know that that's a problem, so to speak. But flat feet, you can identify that when you don't have much of an arch, or if your ankles turn in. So you don't really have to have completely flat feet. But
turn in like this.
Right. If your ankles turn in like this and your feet kind of go out, that's a sign of what's called hyperpronation. And so what happens is walking is the second most common thing we do as a human being, other than breathing. We take about 15,000 steps a day. So if the foot's even slightly off and we're hyperpronating and our joints are overextended, then what happens is the muscles become fatigued and we get tired feet and legs.
Is that always a foot issue? That means when I see people walking with their feet out, you call it hyperpronation.
Hyperpronation.
That's a foot problem?
Yes.
Or a hip problem?
More of a foot problem because the foundation starts at the bottom, so it's a foot problem.
Okay.
Now, not only that, but when we look at the foot, if you look from the back of the foot, some people will see their heels are kind of pointed out, and that all goes together with the arches point in and the toes kind of point out. So that's hyperpronation. So the very least symptoms would be tired, achy feet. But a lot of people don't know that knee pain, especially in the inside of your knee, hip pain and lower back pain are all related, generally speaking, to abnormal foot posture. And the reason for that is that, again, 15,000 times a day we're causing abnormal motions to occur, and it stresses those joints. So as a young person, you may just kind of put it off as a little tired, achy legs and a little pain in the knee. But the problem is over 30 or 40 years, that little bit becomes a lot, and those joints wear out. That's why we have so many patients in their 50s, 60s, 70s getting knee replacements, hip replacements, lower back surgery. And not only that, but let's say you have a fusion in your back. Generally speaking, a few years later, you have to have the next higher level up disc fused. Again, it all starts with a foot. Even if the area is fixed, if we're still putting all those abnormal motions through the feet, through the legs, and up through the body, it's going to eventually take its toll on the next higher joint.
So it's corrected with this minor surgery. I mean, less than an hour for you to do.
Oh, yes, most certainly. The procedure really takes about 15 minutes now to do.
Is that right?
Yep. Hi, I'm Dr. Roth, and I'm here with Brian, a patient of mine who I did surgery with a couple months ago for his flat foot procedure. And Brian was complaining before he saw me of foot fatigue, leg fatigue, particularly knee and hip pain. And so I did this new type of flat foot procedure on him where we put a little implant into the bones of the ankle, so to speak, and we can pretty much instantaneously give him a new functioning foot, which should mean that the knee, hip, and back problems will go away. So, Brian, I want you to kind of tell your experience of what you had before, and what's happened since you had the surgery.
Great. I was a little reticent to come in. I've been to a lot of foot doctors in the past. My wife saw the article in the paper about you, and so she made the call for me and drugged me in here kind of kicking and screaming. But when I got here, your manner was wonderful, great bedside manner. Enjoyed working with you on this. The procedure that you've done has dramatically reduced my knee pain and my hip pain, my foot pain, especially in the toes. I actually notice a new distribution of weight on the sole of my foot. It used to be, since I was born, my flat feet, I'd have a complete distribution of weight on that foot. Now it's around the ball and around the outside and in the heel. The inside of my foot where the arch is, I'm not feeling weight distribution there, but I'm still feeling it on this foot. So I know my foot's caving to the inside. I know it's putting pressure on the medial side of my knee, outside of my hip, and it's just going to continue to create pain. I've had reduced pain in my knee and hip here, the same amount of pain in my knee and hip on the left side. So I'm very much looking forward to the next procedure where we can get that fixed and start reducing pain in my knee and hip for the years ahead.
I want to show you how the foot works now that it's been repaired. The foot goes up and down very nicely, and we've gotten rid of the abnormal motion. We can't even show you the abnormal motion on this foot because it's been fixed. Now on the left foot, I'm going to show you the abnormal motion, so to speak. Do you see how the foot kind of wants to splay out and come out like this? And we have the collapse and a bulging of this area, so the foot does this. For the flat-footed person, I want to show you exactly what's happening. So let me get my bones here, and I'll show you. It's very simple. Basically, we have the leg, and this is the main foot bone, and so all the weight of the body goes through this bone here, which is a talus bone. And in a flat foot, it's very simple. This bone, all the weight comes down, and then the bone starts to go down, and you can see how we're getting a flat foot now. And not only does it go down, but it also starts to go like this, in this way. So it goes inside and down. That's what happens. Well, this procedure was developed by a friend of mine, and what he did very ingeniously is he figured out that there's a natural space between these two bones when they're in the correct position. And I don't know if you can see this, but there's a little hole in here between these two bones. And so this implant, here's the implant here, it fits into that natural space. And by keeping that space open and not allowing it to collapse when the bone slides down and off, we're able to maintain a better positioned foot and stop this bone from rolling down and in. So when the flat-footed person does this, their foot, instead of going up, which was the normal position, it goes out like this and up. And this bone, the talus bone, becomes prominent in this part of the foot. So in other words, their ankles are turning in. When this happens, all the pressure starts to go on the knee, the outside of the hip, and the lower back. So by repositioning this foot and allowing it just to go up and down, it takes the stress off the knee, the hip, and lower back area.
So before the procedure,
Yes.
how comfortable does he make you with understanding the procedure?
He made me extremely comfortable because when I came in here, my foot was sideways.
Mm-hmm.
My whole hips are out, my whole back was out. I've been in 4 car accidents, so I have problems. And my problems on my back were not going away. The problems on my feet were getting worse. No one was helping me. It was just getting worse and worse, so I could hardly walk.
Mm-hmm.
And as I said, I saw him in the OC Health and read about him, and because of Hogue, I have a lot of confidence in. So I came here, and number one, he said, I can fix it. Every other doctor said, I can't fix it.
You've never heard that before?
No. He says, I can fix it. That was number one. And then he told me about the titanium screw that you put in, because my bones were so bad, they had all shifted out of place, which made my hip shift out of place, which made my back shift out of place. And I have a jaw injury that for 20 years they've been putting in place. It snaps and you can hear it 3 rooms away.
Okay.
As soon as he did my feet, It put everything else back into place. My jaw doesn't even, this is the first time in 20 years my jaw hasn't been had to be put back in place
Because of your
again.
feet. You're
because
convinced
of my
of that.
feet. I know it. Because everything's connected from your feet up to your legs, up to your hips, to your back. Everything is connected in your body. So if one part of your body is out, it affects everything else. And my pain wasn't going away in my back, which it usually does. As soon as he fixed it, the pain went away. And in fact, I haven't even been getting as much pain as I used to get. My jaw doesn't go out of place anymore. My neck doesn't hurt anymore.
What is your message to somebody watching this with flat feet, sore feet?
It's like I said to my friend the other day. I'm standing here 3 weeks after surgery, no pain pills, hardly any swelling. I'm standing here getting my hair done and my nails 3 weeks after major surgery, and I'm in no pain. You're standing there in pain. You can't wear any of your shoes. You can't walk anymore. And you're telling me you don't want to get it fixed? I shamed her into it. She came.
Okay.
Because
good.
why do you want to walk around in pain when I'm standing here saying 3 weeks after surgery, I feel great. I'm walking around, I have no pain, I didn't even take one pain pill.
Okay, good.
In fact, the first operation was the day before Thanksgiving. He called me the next morning. He says, how are you feeling? I had my face mask on, watching the Macy's Day Parade, saying, I feel great, this is super.
What about the results? I mean, you know, now that you've been doing it for quite some time, are you ever surprised?
I'm
People
always
would have-
surprised.
Is that right? Okay.
Yes. I love to hear the patients tell me what it's done to change their lives. Generally speaking, you know, we just expect they're going to feel better. But people have told me that it changes their lives in the sense that they're able to sleep better because they don't have that lower back pain. They're able to stand and do more athletic activities. They're able to participate in sports for a longer period of time. It is an internal orthotic. It takes the place of arch supports, but then even more so than that, it's probably twice as good as the best arch support you could ever get.
So the person with flat feet, as a podiatrist, foot and ankle surgeon, the flat-footed person, do they always have problems? I mean, these are people that are just about guaranteed to have foot problems?
I think
or
so.
pain associated with it?
I think so. Generally speaking, a lot of people just don't understand it. But if you have tired legs, achy feet, burning pain in your feet, just unable to be active in exercises for the full period of time that you want to, any of those types of things, you're a candidate
So
for
what were
this.
surgeons doing 15 years ago, 20 years ago, or just 10 years ago for flat feet?
Right.
And
Well,
what are you doing today?
Yeah, there's two schools of thought. One, it would be a complete reconstruction of the foot, which is, like I was explaining to you before, very difficult, long periods of recuperation. The surgery is very hard to do, and quite frankly, probably about a 50% success rate. You just never know if you're going to be the one that benefits from the surgery. This surgery that I'm doing was originated about 40 years ago, and there's been many different types of stents, implants that have been made over the years. Some of them we had to cement in, some we had to take pieces of bone out of the foot, some we had to do, you know, different things here and there. And up until this recent surgery, which is about 3 years old now, it was still about a 50% success rate, although a lot easier than the traditional heavy-duty surgeries. Still, you could flip a coin. You never knew if a person was going to be able to tolerate the implant or not, meaning if they're having pain wearing it, using it, and then they have to take it out. This procedure is about 98% successful, meaning 98% of patients have the implant and have no problems. They tolerate them, and only about 2% we have to take them out.
So it's a titanium implant.
This is a titanium implant. It's inserted into the foot through a very small incision, about 5/8 of an inch, under local anesthesia, and we have to immobilize the patient for about 3 weeks so that the scar tissue scars in place.
So what does it correct, though? That's the part I'm not getting.
Right.
What problem does it correct, and how is it eliminating pain?
Right. Well, what it does is there's the talus bone inside the foot, and as I was explaining earlier and showing with the foot model, the talus bone moves in and goes down, and that's part of pronation. So that's your foot doing this. This little implant, stent if you will, holds a space open in the foot, and it keeps the bone from going down and in, or lessens its ability to do that. And the beautiful part about this operation is, let's say you're in that 2% that don't tolerate it, it's very simple to take out. There's nothing bad that's going to happen.
My flat feet cause me a lot of problems with my knees, my hips, my lower back, and my neck not being in balance. And since I've had the implants put in, it has taken the pressure off my knees. My knees don't hurt anymore. My hips don't hurt anymore. The pressure off my back is better. And my neck is back lined up too again. My feet were very painful, constant pain. I've been wearing orthotics since I was like 13 years old, and they just ached constantly. It felt like someone was taking a hammer and just beating them constantly. And now they do not hurt like that at all anymore. I'm out moving around. My feet felt better immediately. It was fantastic. And I was able to even get up and down. Even after my surgery, I was still able to get up and off of the couch and the bed to moving around a little bit here and there. And then when it would start aching a little bit, I'd lay back down again. But I could feel the difference immediately. So it's just been fantastic. It's the best thing I've ever done. It's the best investment, best health. I'm moving better, more fluidly. It's just been fantastic for me. It may sound like I'm exaggerating. I'm not. I wouldn't be here if I didn't believe in what I just went through. And it has been like night and day for me. It has been just, it's opened up a whole, yeah, it's changed my life. It's opened up a whole new world. I can move and be on my feet all day without the pounding pain of how my flat feet were. So the implant has brought my feet back up to normal position, and I am back in alignment and feeling very well.
For those of you just tuning in, we're here at Hoag Hospital. We're here with Dr. Roth, and this patient right here is going to undergo a procedure. Why don't you tell him, Dr. Roth?
Right. This is a new procedure to pretty much instantaneously correct flat foot condition, and also because of his flat foot condition, the way his foot's working, he's squished the nerves into his foot. He's complaining of numbness, tingling, and burning to his foot. So we're going to do 2 procedures today. What I'm going to do is just show you the approximate location of where the incision is. You just relax just for a second. And it's on the outside of the ankle here, and it's just about 5/8 of an inch long, and that's it. That's where we're gonna.
Now you're saying you're doing an implant?
Right. This is where the implant will go.
Okay.
Right here.
Now he said he has pain. Is that right?
Yeah, that's right.
Okay. How soon before his pain goes away? Will he notice a difference?
Well, in most patients, their pain can go away instantaneously. So tomorrow, the shooting pain should go away in his foot. That happens about 85% of the time.
How soon is he walking around?
He'll be walking with a cast, in this particular case, a removable cast right after surgery.
Okay. All right.
All right, we're all ready to go in.
Let's do it.
Okay, we're going to go into surgery. We're going to bring the cameras in there with Dr. Roth, and our camera crew will, I guess, put on some garb and
exactly.
ready to
Get 'em
go.
all
We'll be right back.
fixed up. So, as I was explaining earlier, this is where the incision goes, about 5/8 of an inch on the outside of the ankle, and we're just ready to give a little local anesthesia here. This procedure can be done under straight local anesthesia, or we can do it under twilight anesthesia. And basically, we got to find the special little spot where the needle goes in all the way. And then I'm going to put my local anesthetic in here. So again, really, we can just do this under straight local, because once I put the medicine in here, then you don't feel anything. Let's just go through it one more time without the implant. You can see the foot's on an angle here. And when I put the implant in, you'll notice that it'll be completely flat. So right now we're on an angle, and take a look at the arch, see what's happening here. We got bulging of this area. So here's the actual implant. These threads here are so that scar tissue can grow over this area, and it's held in very firmly. And now when I push up, his foot is on a flat plane, as you can see. Just to show you, this is the bone here that we're looking at, that I showed you on the x-ray, and we want to be about halfway past, we want to be in the halfway point of the bone. So we're nice and deep in the canal, and the position is perfect. It's on an angle, so we know everything looks great. Okay, we're done.
You're watching the Wellness Hour. We're on location today. We're here with Brian. Brian had flat feet. Now he only has, I guess, 1 foot with flat feet.
That's correct.
So this having flat feet, and I've talked to Dr. Roth, and I'm very skeptical, and I've told you as well off camera that they fixed 1 flat foot, and you already have you say you feel a difference in less leg pain, hip pain.
Knee, hip, foot, ankle.
How did you hear about this procedure?
I read about it in an article in the Daily Pilot. It's a local rag we have here in Newport Beach. And
so you were in
didn't
pain?
think much about it. I set it on the counter. My wife ran across it and said, "You're going."
Because she heard you complaining about your feet all the time.
Yeah, we've been together 24 years, so she's seen the progression worsen over the years.
Now, I told you off camera, I said, I have flat feet, and you told me, you got to get it done. It's just a matter of time before.
You don't even think about it.
But
you
you're
just
an
go
athlete.
do it.
I mean, you were an athlete.
Absolutely.
And how do you know it wasn't what you did as an athlete, the wear and tear, and how do you know it was your flat feet?
I think it's a combination of the two.
Okay.
I think the flat feet basically add 2 or 3 to 1 mileage on your feet.
Okay.
Because of the anatomical orientation of the bones, they're just not in the right place. So you're going to wear things out a lot quicker.
So it's a 1-hour procedure. I mean, the
It's about
surgery
15
itself.
minutes.
Is that right?
You know, from into and out of, you got some pre-preparatory work to do, and you got some post-op work to do, but the actual procedure on the ankle itself might last 10, 15 minutes at the outside. This is an in and out deal. I walked out of the outpatient center.
So 4 weeks later, you felt better. Your foot felt better.
Yes, I would say mild sprained ankle for about 3 to 5 days,
Okay.
with pain dramatically dropping off after that. But the pain was on a scale of 1 to 10, maybe a 2, 2.5.
Okay.
So it drops down to a 1 or less after that, and then completely dissipates.
So your second foot, you're looking forward to this.
Very much, absolutely. I was very, very skeptical. I mean, I told Dr. Roth when I came in here, you know, he's talking about no pain and blah, 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 and
Okay.
so the second time I came in for a follow-up, I told him, I got to apologize to you. And he said, well, what for? I said, because I didn't believe you. I thought you were a little bit of a quack regarding the pain level.
Okay.
This was very, very low pain.
Everybody should do this with flat feet.
There's no excuse. There's no reason. You should not procrastinate. Just come in and do it. I played golf 2.5 weeks, 3 weeks after the procedure, and have been since. So you're out for maybe 2 to 3 weeks per foot.
Okay.
I mean, this is an easy fix to a very significant health problem.
We're here with Dr. Roth, and he is showing us what hyperpronation is and what happens when you have flat feet. Okay. So
Right.
you show this demonstration to your patients.
Exactly. I show them with my hands and then I show them with my body. Basically, hyperpronation is the arches collapsing or the ankles turning in. So what happens is if I turn my ankles in, you'll see that the knees go in and it's stretching on the knee ligaments, and that's what causes uneven pressure on the knees. The hips point out and the back is tilted forward. The pelvis is tilted forward, thereby putting pressure on the lower spine. So if we can fix hyperpronation, what happens is everything straightens out. The legs, the knees, hip, and back straighten out, and it takes the stress and strain off.
Now, anybody that's ever worn an orthotic has felt this experience.
That's right.
Where an insert, now all of a sudden...
Right, yes. They feel
Is it
taut.
the same thing?
It's similar, but to a much greater level.
Now, you talk about arch supports, and that's how it's been helping people with flat feet in the past, but that works.
Traditionally,
It takes away pain, these arch supports.
yeah, traditionally arch supports are what we've used because that's all we had. It was that or the radical surgery.
So what's wrong with arch supports?
Well, first of all, I would compare it to eyeglasses. There's nothing wrong. They work fine, but you can't use them when you go to the beach or wear slippers, sandals, barefoot, all those things we want to do, stylish shoes, etc. And even the best arch support is about only as 50% as effective as this surgery. So although they're okay, if you really want to get quote-unquote fixed up and not have to worry about putting arch supports and where did I put them and the dog ate them and inconvenience, etc., we get the surgery done. And
It sounds simplistic. You put in a titanium implant or stent and the pain goes away, corrects the foot problem, a genetic foot problem. Is it that simple?
It is simple. This fellow came up with a simple, dependable surgery. It's really unbelievable.
Do you think if there was a try-in period that I'm sure it's not possible, but a try-in period that people could no way go back to arch supports or not having it done?
I think there's no question about it because all my patients that I've done this on and the doctor who taught me the procedure, they're sending all their relatives, friends, neighbors. I mean, they really realize the benefit of this surgery. So it's a phenomenal surgery. It's
What do you say to
brand new.
parents watching this, their children have flat feet? What can you do for them? At what age can you do something?
Around 5 years of age is when we can start correcting them with this implant. Really just want them to be, listen to directions and you know, somewhat try to control them, so to speak.
So they don't have to be fully grown?
No, not at all. That's the beauty of this procedure. You can do it from anywhere up from 5 up to, the oldest patient we've had is 91.
91 years old.
91.
How has this procedure, and we're just about out of time, changed your job as a foot and ankle surgeon?
Well, it's given me so much more, it has given me so many more ways to help the patient. I mean, these are things that we couldn't have done 5 years ago, and now we can really change lives. Not only help them with their foot problems, but really help them avoid knee, hip, and back problems, and that is a wonderful feeling.
Final message. Somebody watching this, they know they have flat feet, achy feet, but they're skeptical like I am. What do you say to them? What's their first move?
I would say you're welcome to come to the practice. Take a look at the website, and we'll give you all your options, and then you'll be a better informed patient, and you can make your own decision.
Who's not a candidate for this, by the way?
About 5% of patients are not a candidate, and usually these candidates, they have advanced arthritis in the foot. That's probably the #1 cause that we can't do the surgery. But about 95% of people with flat foot deformity are candidates. So it's a very, very versatile procedure.
Great. Well, I want to thank you for allowing our cameras right here in your reception area. Very interesting.
Thank you.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you have flat feet, you should find out more. Visit Dr. Russ' website. If you'd like to see this program online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.